If you have risk factors for coronary disease, there's an important screening you should know about. And Dr. William Lewis has joined us here in the MetroHealth studio to tell you what it is. Dr. Lewis is the Chief of Clinical Cardiology at MetroHealth. So welcome to the show.
Good morning.
Before we talk about the screening test, we probably need to know what these risk factors are. So tell us about those first.
So these are your normal risk factors for heart disease. And so we think about advancing age, first of all. We also think about the normal risk factors we talk about with patients. Are you a diabetic? Do you have high cholesterol? Do you have high blood pressure? Are you a smoker? Those are the risk factors that we commonly see in patients with heart disease.
Okay, so if you have one or more of those risk factors, then the screening becomes really important. So we've waited long enough to hear about it, and tell us about the screening test.
So the screening test is a CAT scan. It's a very brief CAT scan. It doesn't require an IV. It takes 5 minutes. You lay down on the CAT scanner, and the scanner goes around your chest really quickly and picks up the amount of calcium in the coronary arteries. And it does so using the amount of radiation that you normally get if you have a mammogram.
Okay, so it's not real dangerous as far as radiation goes, and it's quick and easy. And so this is catching people early on in the coronary disease process?
Correct. So the people that we want to screen are patients who have no history of heart disease already. So if you have a history of heart disease, you follow up with your cardiologist, that's the way that normally happens. If you don't know, or you're asymptomatic, that is, you don't have symptoms, and you have a risk factor, you kind of want to know if you have coronary disease lurking in your body. And this is a great way to find that out.
Okay, good. So what exactly, I mean, you said it was pretty quick and easy, so it doesn't take real long. Is it covered by insurance? It seems like this is important enough that that would be something that insurance would cover.
So it's a screening test, and that by definition it's not covered with insurance. And so we went to great lengths to try and make this affordable for people to try to find out whether they have coronary disease or not, and to know with high certainty whether they have coronary disease.
Okay, so you got the price down as low as you could.
We did.
And
we did. We worked with our colleagues in radiology to see what we could possibly do this for, and we got it down to $40.
That's great. It's like a copay for a lot of things. So.
It is. It is.
And it's so important, it sounds like. It sounds like it's a very much of a life-saving test. So if you know you've got the potential for something to be really wrong in your heart, that you can plan for it.
Correct. And you can plan for it. You can initiate treatments to prevent coronary disease, and you can have discussions with your doctor to try to find out whether further testing is required.
If you're at that early stage, so there really are things that you can do to kind of prevent it or turn it around?
Absolutely. First of all, modifying your risk factors, right? So if you're overweight, you want to lose weight. If you don't exercise, you want to consider exercise with the guidance of a physician. You want to try to eat right, lower your cholesterol, and oh, by the way, if you smoke, you should stop.
Yeah, that one goes without saying. Calcium screening is an amazing test that can almost see into the future for those at risk of heart disease. And thanks to the efforts of Dr. Lewis and MetroHealth, the screening is also at a cost, just $40, that allows those at risk to take advantage of it. By changing the way we screen for coronary disease, MetroHealth is demonstrating once again that change is healthy.
To learn more, call MetroHealth at 216-778-7800. or log on to www.metrohealth.org.